Hi everyone. At the risk of being a minute early, I'll get started. Welcome to tonight's webinar on interview skills for doctors in training. It's a very popular session that I run each year. My name's Anita Fletcher and my business is Standout Medical Careers. So I'll get straight into it. There's a lot of ground to cover in a pretty short amount of time, and I'll also be saving some time at the end for questions. So please feel free to put any questions in the chat function as we go, or stay around and ask some questions at the end. And meanwhile, I'll continue to, of course, let other people in. So for those who haven't been in any of these webinars before or met me in some other way, as I said, my name's Anita, and I work with a range of doctors at all different career stages and in different specialties to support them through whatever their medical careers are presenting in terms of challenges and opportunities. So I've been doing this work since 2015 when I worked for the Australian Medical Association, and I was working for their members in New South Wales and then across Australia for a 5-year period. So I've met many doctors and been a part of helping them navigate a whole lot of challenges. And as I said, the interviews each year are certainly a hot topic for everyone at the moment, as always. So some of the core services that I offer are listed here, helping people plan out their careers. So sometimes that's doctors looking for going in a different direction within medicine or even beyond medicine and exploring non-clinical opportunities. And I also do a lot of work on CVs. I got some very happy feedback from a client this morning who needed some work, some considerable amount of work on his CV, and then of course interviews. So we'll get into that. Very quickly, I'm also very proud to have a partnership with MEGA, one of the 4 medical indemnity providers in Australia. And we've recently hosted 2 of our 4 annual webinars that we've run for the past, I think this is year 4, past few years for MEGA members who are medical students or doctors in training. So for anyone who's a MEGA member, the next webinars are coming up in May. So have a look at your comms from MEGA to register for those events, one on CVs and one on interviews. And I also offer discounts for MEGA members. So let's get into it. Good to see so many people joining. Quite a lot of people have registered. So welcome again. And so I really believe that people can get more out of an interview than simply turn up and answer the questions that are being asked of them. And of course, it is essential that we do turn up and answer the questions that are being asked. But I really, when I work with people, I position them to try and think about the information that they really want to get across in an interview and really inform people of their value. So often people ask me, how do I stand out? How do I present myself as a great candidate if I haven't done anything in particular that's special or what they're looking for? And we work together to uncover what it is that they can bring into that interview in order to share really strong information about them. So that's what that statement is all about. So I really implore you to think about that. I've recently run 3 webinars And one of them was all about how to convey your value. And those recordings are on the Standout Medical Careers YouTube channel. So you can refer to those if you're interested in looking into that a bit further. So today there's only so much we can do in 45 minutes and include questions. So mainly preparing your story and the value proposition that you're going to share with the panel when you get to the interview. Really focus on some of the key highlights that you can be drawing out of your CV and your experiences to share with them, creating structured responses, and also looking at some common questions. And as I've said, I'm really keen on people asking questions. I can't see the chat function in front of me now, so I will stop presenting at about 7:30 to have a look at those, and also to, invite anyone to turn off their microphone and have a chat. And I can stop recording then if people prefer also. I'm very invested in you getting the most out of this as possible. But before we get into those things, I really want you to have a think about what it is that panels are looking for when you're approaching this process. So they're listed there. Really, they're looking at your skills, your attitudes. Think about the information they can find on your CV and other application documents before you walk into the room is pretty extensive, and often they'll have already spoken to referees as well and have other material to work from. So they know a fair amount about you, but it is definitely your job to also remind them of those things, because nobody can remember everything about every candidate that's on everyone's CV. So it's your job to really convey this information about you. What is it that you bring to a position, your skills, what your attitude is, what you'll like to work with, and does your style match up with what the team, that of the team that you're looking to enter? Really, it's your job to highlight key achievements. If you don't do it, nobody else will. And as I said, you can't rely on the panel remembering everything that's in your CV. They want to know what you've learned and what you want to learn and how you go about learning, particularly for the specialty training programs. So I'll touch a bit more on that later. I know there are some people in this session who are applying for specialty training this year. So, look at those programs as very much, well, they're training programs. So the panelists really want to know how you approach learning. Are you going to stay the course? Are you going to make the most of what they offer you during that period? And then even what are you going to do with that later on in terms of sharing that knowledge with others in the form of teaching?
Apologies, Anita. Are we supposed to be seeing slides?
Yes, you are. And thank you so much for mentioning that you can't, because this has happened again recently. And I really appreciate you saying that. So thank you. I'm going to go back to the beginning and walk through those. So can you see them now?
Yes, thank you.
Okay, thank you very much. Okay, so here we are. I've introduced myself, mentioned a few of the core services of Standout Medical Careers, touched on the partnership that I have with MEGA, and put up this statement conveying the theme of making sure that you are really, this is what an interview is all about. It's bringing what you have to offer to people and communicating that to them in the most articulate and clear way possible, all in the space often of 15 minutes, in settings that a lot of people find extremely confronting. And a lot of my clients tell me about how nervous they get with the interviews. So sure, definitely go into it thinking, what could they ask me, and how will I answer? but also go into it really positioning your value front and center, and having that content developed. So that was the slide showing the overview of what we're covering tonight. And here's where we got up to when someone kindly pointed out that the slides weren't visible. So these are the things that the panels really want to find out about you. As I said, bearing in mind that they also have other material that they can draw on with information about you. And, you know, I mentioned recordings on the YouTube channel. There's also recordings on CVs that I've been doing these for the last, well, since I started the business. And this year I've been recording and putting them up on the YouTube channel so people can refer to them. So I hope they're helpful. Your CV is so important. That's sort of the first impression they get of you, and then they want to meet this person that they've read about, the person that they've seen presented on paper, and these are the core things that they want to know. And you know, attitude's a big one. Your ability for them to teach you to do the work that they want you to do. And you know, your sense of responsibility and risk as well, and how you get on with people is incredibly important. So have a look first of all at really what is the role. And I really find that a lot of people underdo this research side of things when they're looking at either employment or employment and training positions. The colleges, so job ads are sources of information that are really valuable. So are hospital and health service websites. So are the websites of particular departments within some hospitals that are available. And so are the position descriptions that are often attached via link on a job ad. I really implore everyone to carefully read those, because there's so much information often about what they're going to be assessing candidates on. It's under the selection criteria section. And there's also information about the organisation as on the whole, what they're looking to do. And tonight's really for doctors in training, but I've been working with a consultant recently who applied for a role, and she was able to send me a very lengthy document on what the vision of the health service is, a large service in a large state in Australia, for the next 10 years, what they want to achieve. And it was so content rich, and I learned a lot, and we worked and really developed her responses largely based on what was in there. So make sure you know what the role entails. That's really going to help you present and show them in the interview that you've done your homework, and you've also potentially spoken with people who work there, and they can pick up if you've done that. It's great to get any insider knowledge as well on any challenges, what it's like how you're going to fit into that team. And if they have any particular projects or problems that they want solutions to, that you can assist them with. And as I said, they'll often those pieces of information are quite easy to find once you start looking. Okay, now it's really important also that you share your story. So this question is such an opportunity. If you ever get asked this or something similar, it's basically giving you the floor for 2 minutes or more to give them all that great content that you've been preparing, and telling them the key pieces of information that you want them to know. So I had a client recently who was applying for a fellowship position in the UK, and I'm very happy to say that she got that role. But the first time I asked her that question, it was a really brief response. And I said, you've got to give me more than that. And I've seen your CV and I know how much more you can tell me, that also in relation to this position. And I had the position description for that role. You know, when I work with people, I look at that material and I look at the materials that the colleges put out as well. They produce, you know, very lengthy and really informative documents that are valuable resources. So, you know, you can tie in some of that research with then, okay, what will they be interested in? A bit about your background, your current situation. In her case, in that fellow's case, and actually we'd worked together when I was back at the AMA. I helped her with her CV back then. And so great to see where she is now. But I pointed out to her, you know, she was talking about Sydney hospitals that she's worked in. And I said, you might want to give some context around the size of those hospitals and something about them, because the people in London aren't necessarily going to know what they're doing there. You know, what's RPA, you know, chances are they might, but you can't make that assumption. So think about in terms of where you're going, what would they know about that, where you're working and what you've done in the past. Don't assume any knowledge. You really don't know what their awareness is of those aspects of your work. So give them a bit about your background. It's nice to, you know, people often share a story about where they've grown up. I hear often from people who want to enter into rural and regional areas and rural training pathways, that they share the stories that they've grown up in rural areas. And that is so relevant and so important to share, because the people in the room will really notice that and they'll pay attention. Then when it comes to your current situation, just don't underdo it. You know, anyone can say, okay, I'm an RMO, or I'm an SRMO, or I'm an unaccredited registrar, whatever the case is for you. Tell them a bit more about that. So tell them maybe what you're enjoying about it and what's going well. You know, and I don't mean going into a very long story about that, but think about anything key information that might stand out in their minds. Because bear in mind too that you've got about 2 minutes to cover some if not all of these points. Well, this is my recommendation, but it's a guide. You know, you make of it. You've got to tell your story as you want to. Objectives, though, are really important. So stating, you know, career goals and objectives. Is there anything that you're immediately doing in order to progress towards that goal of getting onto training, for example? And, you know, I just think of all the people I've already worked with this year, and they've got a goal and they've really articulated very well, and we've worked together to pull out, you know, let's make sure they know about, you know, you doing this course that is out of the ordinary for someone at your level of training. You know, like I said, if you don't tell them, they won't know, and you can't assume that they've picked it up on reading your CV. Or that they remember. So also it's great to mention strengths at any point in the interview. And I appreciate you won't necessarily get everything into this first question. But if not there, then try and bring it in as well afterwards. And, you know, what do you stand for? What are you looking for? What do you hope to provide as a doctor for other people, including, you know, of course, patients and colleagues, and whatever it is for you, let people know that, you know, that's the purpose of you being there. So don't not waste the opportunity, but don't sort of sell yourself short and leave the meeting wishing that you had mentioned some of these things. And you know, that's where the preparation really comes into it. I'm a massive fan of preparation and practice. So when it comes to highlight, I'm mentioning strengths again, and apologies for the double up of those page numbers. It's really annoying. I saw a few, but didn't get to check through all of them once I noticed that have been an issue. But, you know, write down your strengths. And I've been speaking to a few people this week, and they sort of come up with a couple and they're really thinking on it. That's fine while we're in preparation mode, but I don't want anybody to be caught like a rabbit in the headlights without being able to pull some of those strengths out, you know, at the drop of a hat in an interview. And if we've all got strengths and you want to share with people whatever they are, they want to know. And they're the people who do well in interviews are good at that. You know, a lot of people say, I can't sell myself. Well, someone who can sell themselves is someone who can speak about their strengths and their achievements. And by doing this, you're not only collating valuable information for your interview content, but you're building your confidence as you prepare for this opportunity that I hope you can end up going into, kind of looking forward to it. That might be a stretch for some people, but often, you know, people do come around to that, and there's still a lot of reticence about, you know, how they're going to perform on the day. But overall, people want to get this done and see where it takes them, and of course do it to the best of their ability. So also, if you've have any other roles apart from your direct clinical skills, of course, administration is part of every doctor's daily work. And so is leadership in a lot of ways, within the ward or the private setting, wherever they're working. And if you have any leanings towards leadership or experience in leadership positions, please mention those at some point throughout the interview, even if you're not directly asked. That's a great thing to mention in that. Tell us about yourself as well. That's a really strong start to an interview if you've got some experience working with other people. And I was working with a client on Sunday actually, and he's got quite a lot of that. So, you know, that really aligns with the ANZCA roles in practice, and, you know, and the competencies of ANZCA, which all of the colleges list their competencies, and we were I was impressing on him to look at those roles and be able to speak to each of them, because that's what you're going to be assessed on in an interview. Okay, any awards, other forms of recognition, certainly put them in your CV. It does not hurt to mention them if the time's right. Within the interview, it's not boasting. You know, I wouldn't run off a whole list of them, but you could refer to them and say, I have received some scholarships or some university prizes during my time at medical school, or doing my master's, or whatever it is that applies to you, because that will get people in the room to look down at your CV as well, and they'll see those particular achievements that are a great way to stand out from other candidates. And overall, any of your achievements certainly should not be your best kept secret. You know, nothing's worse, I think, in my experience myself, of walking out of interviews in my career, feeling like there were key things I wanted the panel to know. So whatever it is for you, hopefully you've got a bit of these, each of these, or you're working towards them. Let people know, and indeed also let people know what you are working towards. They'll want to know what you're currently doing to improve your practice and all of your skills. Okay, so I'm not going to go through each of these points. I've just noticed that we're about halfway through my slide deck, and I'm very keen to take questions. So please take a screenshot, or, you know, ponder on these questions later on, because they're great ways. I think they're good questions for you to think about what you can put forward to people, even if you're not directly asked a question, such as this first one. You know, you may not be asked that in an interview, but if you've got that content prepared that you're able to bring into an example, when you're telling a story about a case, or the way you've dealt with something, I think these are good preparation type questions for doing that. Okay, we've covered off on achievements. You know, I really want you to think about what is unique to you, your abilities. Everybody has them, even people, you know, and people, like I said at the beginning, some people say to me, oh, I feel like I haven't got anything that's, you know, really stands out from other people, that's different to anyone. Your personality, how you work, how you operate, there's all things that are worth sharing with a panel. So don't fall short of doing that. Don't miss that opportunity to do that. Be ready to talk about any particular areas of knowledge that you're really strong on, or that you're really interested in. Share information about you essentially with people. I include this reference to an RACP resource because I just think it's really good. And I think that by reading that, everybody can, I think, better understand the types of things that organisations are looking for, and not just in your training years, but beyond, when you're through your training and practicing as a more senior clinician. Okay, on to some structure. I really want you to think about when you last practiced for an interview, and if it's been a while, I implore you to start practicing. Even if you did 10 or 15 minutes a week, it's going to make a difference. So set some time aside. It could be you do a question, you know, one every day. You do a question in your lunch break, you look up a question and you have a think about it, or make some notes. I know that probably won't happen. A lot of you probably don't take very long lunch breaks, and you're at work, but whatever that time is for you, or if it's a Saturday morning and you think, I'll spend half an hour on Saturday mornings in the lead up to the interview, or once every 2 weeks, just get some regular practice in. It really, really makes a difference. When I'm working with people, we have a few sessions in our programs, and I see really big leaps and bounds with people over the course of the time that we're working together. So I've touched on these things. Apart from making contact with the organisation, if there's a contact person, boy, pick up the phone or email them and speak to them. I cannot tell you how many stories I hear about people knowing someone and then walking in and that person's on the panel. It makes a really big difference if you've had some kind of contact with individuals involved with this recruitment process in some form. So it's not unreasonable if they've provided that contact information. Be proactive and contact them. They will notice that. I've talked about preparation and practice. Now we're going to look at a few questions again, but first, these are, in a nutshell, some of the other things that people are looking for. So, is there a point of difference from other candidates? Do you stand out? Is there something in particular that you've done that will catch your eye, stick in their mind, impress them? That fit is so important. I just can't overstate that, and I think you've realised too in your work experience and lives so far, how much being a good team member will take you a very long way. And it's not by any accident that every college's list of competencies includes teamwork as a competency. So it's highly likely that you're going to be asked a question about how you work within a team in some form or another. And even if you're not asked, bring that content in somewhere to one of your responses, if not more than one. The self-initiated projects or something where you've gone above and beyond is a really great piece of information also to present in an interview. This is in relation to anaesthetics. How are you going to get through the primary exams, and of course in other specialties, the exams? They want to know when you're applying for specialty training that you're going to succeed in that program, and they want to know that you're going to stay the course, that you have what it takes to pass those extremely challenging exams within the challenging profession that you're in, because they don't want someone signing up to then take a place and discontinue the training. They want to make sure that it's a success for everybody. So that's why they scrutinise people as they do. And then, you know, the connection to a particular city or state. It's that human side of it. And what are you going to do with this experience that they give to you? A few structures now, you're possibly quite familiar with these. If you would like, I'm not going to go through them all. You are welcome to take screenshots. You can also email me if you like a resource that lists these and a few other pointers. And now some questions, some sample questions. Again, I'm not going to go through each one of these, but there's themes within interviews, and dealing with issues, challenging situations is definitely a very common question. So it might come at you in any question really, but it's the theme that they're looking for. How do you manage that? How do you manage poor performance by colleagues? How do you manage conflict is incredibly commonly asked. And, you know, dealing with work when things are getting tough, whether it's a challenging consultation or there's a lack of resources, thin on the ground with staff, whatever it is, they want to know how you're going to manage in those situations. And it's often in the form of a behavioural style question. Tell us about a time when you've experienced this. What did you do? And really importantly, not only is it to take them through what you did, but what you learned and how that will change your practice, how that's changed your practice moving forward. Stepping up is a really big part of this as well. So if you have had the opportunity to step up in some way, taken on additional responsibilities, share that content with people. And this is sort of the gold that I often dig out for people's CVs when I speak with them and ask them what some of the highlights of their last rotation or current rotation is. And sometimes they say, oh, you know, no, I've only been there a few weeks, but then lo and behold, they say, oh, well, actually, I did do this. You know, a few weeks ago, I was asked to step up in this way, and I was able to do that, and it went down very well with the bosses. And there you go. There's a great example, okay, of how you work, what you're like to work with, how they can count on you to step into the role and support the team when it's needed. Okay, and then again, similarly, so types of questions that you can expect is, so sort of approach this in a few different ways, trying to let you know what you're going to face when you walk in that room. A lot of people really want to know why you want to work in that particular location and team, or train in a particular specialty, and your commitment to being in that place or that that training program. So skills, pretty self-explanatory there. Your values, often people are asked to tell the panel about one or two of their greatest achievements. And that's not just an exploration of what you've done well at, it is also an exploration of your values, because it's by the examples that you present to them and the story you tell around that, they're able to draw from that information the type of person that you are and what's important to you. There is often a curveball question. This was one that was asked a few years ago for an anesthetics role. And actually, I was chatting with someone about this yesterday because she said that she had come across that as well. And greatest weakness is definitely a question that is asked, and they're looking there for insight. Have you self-reflected, and what are you doing about it? So if you've identified a weakness, please be able to share that with the panel and tell them what your plan is to address that. In the meeting I had on Sunday, my client gave me one that I said to him, I'm not sure that's a great answer. I think you could come up with something else that isn't going to potentially be a red flag. I'm not going to share what it was, but in the interest of privacy, but you know, have a think about how will that go down. And a few years ago, I had a client and he just said, oh, I'm really not vain, and I know I've got them, but I just can't think of something that's going to be appropriate in an interview. And we ended up coming up together with public speaking. And I thought that was quite good, because I also think a lot of people can relate to that. And it actually also was very much aligned with his concern about speaking in the interview. He was very nervous when we first started working together. He was really struggling to convey all of the value that he most certainly had. And I glanced at his CV again the other day, actually, and I thought about how, you know, he just had so much on there, but he found it really hard to talk about himself. So that weakness was really authentic, and I think it was a really good choice on his part to go with that. I don't think he was asked the question in the end, but good preparation never goes astray. And he was also to reflect on how he could improve in that area, because he also wants to do more teaching in the future. Okay, so there's a summary really of the themes that I've covered in these slides this evening so far. And I really would also encourage you to think about what's your biggest challenge as you prepare for upcoming interviews. Some of you have been in my webinars before. It's probably not the first time you've seen these, but I think it's really important to ask yourself that question and identify where it is you really need to start focusing your attention. And as you work on each area, you know, set some time aside, as I said, for practicing, but also before that, your CV, if it's your application documents. You've probably got some time now to get that together, but you've really got to get your skates on and make sure that everything's ready and you don't get caught unawares if you suddenly are aware that it's time to apply for a position, or if something comes out of the blue. So do that work, and as I said, certainly start practicing for any interviews that you've got whenever they are this year. now it's over to you to ask me any questions you like. So please put those in the chat. I'm just going to quickly run through a few last slides and then I'll stop sharing the screen. A couple of upcoming events. I've got a small CV course that I'm launching next week. There is a link there if you want to send me an expression of interest for that. And when I'm got the finishing touches on that course, I'll send it through to people. I've also have on the website the homepage of the Standout Medical Careers website's other upcoming webinars, and this one is a 2-hour workshop on Saturday, the 3rd of May. There is a fee for that. I always run free webinars, but on this occasion I'm charging a small fee, and the group will be limited to 10 people, and I think 5 people have already signed up for that one. And the MEGA members webinars, as I said, are happening in May. I'll be traveling to Tasmania in late May. So if anyone is around Hobart and would like to catch up, I'm all for it. I'd love to meet you and sit and have a chat. And that's sitting and having a coffee. It's not an engagement. And I'm in the process of organising a few meetings actually in Canberra and heading down to Albury-Wodonga for a workshop in June. So if anyone's in those regions and you'd like to meet up, please feel free to email me. That's a little overview of what's in the CV course. There's my email address if you need anything. You can always book a free session with me as well that we can do over Zoom and talk about whatever you need to talk about. And there's a blog page on the website that might give you some extra insights or ideas about some of these key themes for doctors. And as I mentioned, the Standout Medical Careers YouTube channel. Okay, so I'm going to stop sharing the slides now and see if anybody has any questions. The chat function, there might be some in there. Okay, great. Thank you. Somebody has put that in. How do you work in a team? Well, thank you for the question. It's a big one. So essentially what I would do with that question is bring in a general statement to highlight some of the skills that you have around teamwork, and then introduce an example that you can refer to demonstrate those skills that you used in a particular situation. So that's my short answer for that. I can come back if we've got time to talk about that further. And refer to the structures there about what a good format might be, and feel free to email me and I'll send you the resources that I mentioned. And then how do you structure the answer for the question, what is your weakness? Thank you, Jess, for that one. So for that, I would say really keeping it fairly straightforward. It doesn't need to have a complicated structure because it's a very direct question. So they've asked you, what's your weakness? You could say something like, I self-reflect on my performance as a doctor, and one of the things that I've identified in recent months is that, say for recent months, whatever the period is for you, is that I could improve in this particular area. I also had some feedback from some of my peers that were in line with that self-reflection of my own. And what I've done is I've started doing these activities in order to improve that weakness. And I've already started seeing some benefits of that approach. And my teammates have also noticed an improvement and they've commented on that. So I think, you know, as I said, it's a straightforward question. So I think a straightforward, fairly brief response to that will be enough. But when I say brief, I mean, you know, give them more than that, you know, than I've just done in 1 or 2 sentences, because you've got time in the interview to expand on that a bit further. I hope that's helpful. Any other questions? Feel free to come off mute too if you prefer. You're welcome, Jess. Very welcome to ask me anything now. And if you prefer not to speak in front of a group, like I said, you can book a meeting with me and we can chat further about this. It seems like nobody else has any questions, so I'll leave it there for now. And thank you again for attending this evening. I hope it's been helpful, and I hope to speak with you sometime in the future, and very best wishes for your interviews this year. Bye for now.